Welcome back, viewers, to Faith and Discipline podcast. Our topic today is fatty liver disease, and our guest is Dr. Ghaznfar Ali. He is a consultant gastroenterologist. Welcome, Dr. Ali, to Faith and Discipline podcast.
Thank you very much for inviting me.
Our first question is, what is fatty liver disease and what are the symptoms?
So, fatty liver is a condition, as the name suggests. There's accumulation of excess fat in the liver. And majority of people with fatty liver, they will not have any symptoms in the beginning until it has gone to an advanced stage. Okay. And that's why it has become very common disease, because many of the people, they have not been picked up when the disease was in early stage.
What are the reasons why it happens?
The main reason for fatty liver is it's associated with certain conditions. And one of the conditions it's associated with strongly is metabolic syndrome. Metabolic syndrome is a combination of at least 3 things from 5 things. Okay. One is people are overweight. Number 2, they are diabetic or they have a tendency to become diabetic in the future. And number 3, they have hypertension. And number 4 is they have high levels of dangerous cholesterol, the cholesterol which is not beneficial. And they have a reduced level of good cholesterol, which is preventing different illnesses in somebody. So I think these are the 5 things. And if a person has 3 among these 5 things, they will be a candidate to get fatty liver.
That was, in fact, my next question. I was going to ask, what is the link between hypertension, high cholesterol? There is another thing which is hypothyroidism. Is there any link between the thyroid being underreactive and fatty liver disease?
Yeah, hypothyroidism, the only link appear in a sense that people with hypothyroidism, if it remains undiagnosed, they will become overweight. Okay. And if they have become overweight, and sometimes thyroid has a relation with diabetes as well. Okay. So it's an indirect link to cause fatty liver. Okay.
So do you mean the thyroid is underactive or overactive when the patient has the diabetes?
People they can have underactive or overactive. So that's another link because they are both a sort of antibody, antigen mediated type of illnesses. But hyperthyroidism doesn't usually cause fatty liver. It's the hypothyroidism. It will only cause fatty liver if it leads to being overweight.
Okay. I believe there are some stages of fatty liver disease, and how many stages are there, and how do we know the patient is going through which stage?
Yeah, fatty liver, it's an umbrella term. Okay. The other name for it in the medical term is non-alcoholic fatty liver. Okay. Alcohol is one of the common reasons for fatty liver, but we have to differentiate fatty liver from alcohol-related fatty livers. So when we say non-alcoholic fatty liver disease, it will cover both fatty liver and there is another term called NASH, non-alcoholic steatohepatitis. So some people will have fatty liver, but they may not have inflammation in the liver or may have minimal inflammation. But other people with fatty liver, they will have significant inflammation and fibrosis, which in other words is called scarring. Okay. So these are the 2 types of fatty liver.
How do you know a patient is going through what? Do we do like some scans and that's how we know, or there are symptoms appear on the patient's body or somehow they feel it?
Yeah, usually fatty liver is picked up sort of incidentally when we do the liver tests. Okay. Liver tests are abnormal. And sometimes people have ultrasound scan either with some symptoms or without symptoms. Okay. And the ultrasound scan may show that they have a fatty liver. In early stages, people with fatty liver, they don't have any symptoms. And the only symptom, some people may have some heaviness or discomfort where the liver is, and that's on the right side of upper part of the tummy.
Okay. The fatty liver disease, does it affect certain genders or age groups, or is it common in everyone?
It's common in both male and female. There's no significant preponderance or excess in either males or females. And age, usually it occurs in people above the age of 50 because that's the age where people will get diabetes, hypertension, they become obese. It's less common in below 50, but some people have at a younger age as well.
Okay, so they can have at any age and can be for any gender. So what is there's a term called hepatitis. What is the difference between hepatitis and cirrhosis of the liver?
Yeah, hepatitis is inflammation in the liver. And if hepatitis persists for many years, then it will lead to cirrhosis of the liver.
Right, okay. And is cirrhosis is the stage where the liver has been damaged significantly?
Yeah. Cirrhosis is the end stage of liver damage.
Okay.
So when the cirrhosis has occurred, it cannot be reversed.
It can't be reversed. Okay. Is fatty liver disease can lead to serious health conditions for the person?
Yeah. Fatty liver on itself, it can lead to inflammation in the liver, and inflammation will lead to cirrhosis of the liver.
Okay. Right.
The other reasons for having ill health due to fatty liver is because it's associated with diabetes and hypertension.
Okay.
And people will have increased health issues because of two reasons. One is due to liver cirrhosis, and second is they may have risk of stroke or heart attack because of diabetes and hypertension.
Okay. Majority of the ailments, they are linked either with diet or lifestyle. In terms of fatty liver disease, which is the main culprit? Is it the lifestyle or is it the diet?
I think it's both.
Both, okay.
Lifestyle means they are not eating the right food and they're not exercising. And I think these are the two main factors in creating fatty liver.
Okay.
Diet and sedentary lifestyles, the lack of exercise over the years, not in a few months, but over the years, will lead to significant liver damage.
Okay.
And it has been estimated that there are different stages of cirrhosis or scarring of the liver as well. It's stage 1, 2, 3, and 4.
Yeah.
And if somebody has fatty liver, if they have only fat accumulation, there's no significant inflammation, then they will progress from one stage to next stage in 14 years' time. 14 years' time.
Okay.
But if they have significant inflammation, the other name for that is NASH, non-alcoholic steatohepatitis. If they have NASH, then every 7 years they go into the next stage of fibrosis.
Okay, right. That's quite scary. Right, okay. So how do we diagnose fatty liver disease? If a patient comes with, they are already suffering from, let's say, high cholesterol, hypertension, they are diabetic, and then they have like some symptoms of fatty liver disease. So can we see the patient and diagnose straight away, or do they go through certain tests?
I think when we see a patient, we get an idea that patient is overweight, he has diabetes, hypertension. So it's likely that he will have the fatty liver.
Okay.
But to diagnose fatty liver, we will need to do some test, and the most appropriate test will be the ultrasound scan of the liver.
Okay.
So there is typical appearance of the liver on ultrasound scan, and that will pick up the fatty liver. And the second is, if you do the blood test, they will have signs of inflammation, which will be in the form of raised liver enzymes.
Liver enzymes, okay. So what do you particularly look at the scan? How is it different from the normal liver?
So the other name for fatty liver on the ultrasound scan is if you have a bright liver.
Right.
It's bright appearance on the ultrasound scan. So
and that's because of all the fat accumulation.
All the fat accumulation in the liver.
Many people, they don't really come to the doctor unless they are really ill, and then they go through when they can't cope anymore. So if somebody wants to self-diagnose themselves and see if symptoms are appearing, and I really need to see my GP or doctor, what type of symptoms there would be for fatty liver when they think like this is now?
The two things. One is that Anybody who is overweight, diabetic, high blood pressure, they should be aware that they may have fatty liver. And the other people, they may have symptoms in the form of they may feel tired, or they may have just discomfort in the upper part of the tummy on the right side. So these are the two most common symptoms if one can come up with symptoms.
Are there any like skin problems associated with fatty liver disease where the patient have like web forming kind of veins appearing on the skin, anything like that?
I think that's a sign of cirrhosis of the liver. So if the patient has advanced to that stage, when they have developed cirrhosis, then there will be signs of cirrhosis, and they will have big tummy because of fluid in the tummy. They may have engorged veins around the belly button. They may have jaundice, and they may have some red spider-like spots on the back, particularly on the back of the chest. These are signs associated with cirrhosis, not at early stage of fatty liver.
Okay, fine. Right. So, what are the treatment options? How do we treat those patients?
I think that's why we need to aware the public that the only treatment for this condition is prevention. So if somebody has a risk factors for fatty liver, they should be aware that they should start working on their lifestyle at early stage. And if they can prevent from fatty liver into going into cirrhosis, that will be the best treatment. But if somebody has already developed fatty liver, then the treatment is mainly in the form of lifestyle change. They need to, if somebody is overweight, he must lose at least 7% of the weight, and that will improve the fat collection in the liver. It may not reverse the inflammation, but at least it will prevent the inflammation getting any worse. And second thing is have a good control of diabetes, healthy eating and exercise, and control of all the features of metabolic syndrome need to be controlled. So treat the cholesterol, treat the high blood pressure, lower weight, healthy eating, and good control of diabetes.
But do we prescribe any medication for that?
There is no proven medicine for fatty liver, but people who have fatty liver and diabetes, there is a medicine called pioglitazone. There are different medicines, metformin, pioglitazone. So pioglitazone has shown to have some benefit in improving fatty liver. And there is another thing called vitamin E. And if that's used in people with fatty liver, in 1 or 2 trials, it has shown some benefit that fatty liver can improve.
So is it like over the counter people can buy vitamin E, or is it like prescribed certain amount they should be taking?
I don't think they should. One is that vitamin E has its own side effects. And I think one should not buy it on the counter. They should use it only if the physician has prescribed it, is recommended it. And the same thing with the other tablet. They should only take it if the doctor has recommended it.
Is it one of those conditions where it is easily manageable if the patient is really willing to change their health and improve it, and then go through that phase when they are trying to avoid any type of food which is causing the problem, and they start taking exercise and stuff? Is it easily manageable after that, or even then it can cause problem in the quality of life?
I think if it can be caught early, and if people start changing their lifestyles, then it can be arrested at that stage. But if the condition has led to fibrosis or scarring in the liver, then eventually, if it's not treated, it will cause its complications.
Are there any particular foods which are really bad if the patient is on the journey already, they are diagnosed with fatty liver disease? They should completely stop those foods.
Reduced processed carbohydrates, reduced fat, saturated fat in their food, reduced minimum level of fructose, because fructose is a content in different fruits as well. And sometimes the sweeteners being used in sweet drinks, they will have some component which can cause fatty liver. So these are the things which need to be reduced, and calories should be restricted, and good fat can be used, proteins can be used, carbohydrates can be used, but good carbohydrates, not the processed type of food.
Food is causing fatty liver disease, then food is the cure as well at the same time. If they change the food, it can reverse the fatty liver disease. Can you please tell us which type fats are better?
So fats are two types, saturated and unsaturated fats. Saturated fats are bad. In small amounts it can be used, but if somebody is using saturated fats in significant quantity, animal fats in significant quantity, these are the bad fats. Unsaturated fats like olive oil, vegetable oils, these are, if used in reasonable amount, they shouldn't cause any damage.
There is a link between type 2 diabetes and fatty liver disease. If we reverse the fatty liver disease, can we also reverse the diabetes at the same time?
It's other way around. If you can reverse diabetes, then we can reduce the fatty liver. But fatty liver on itself will not cure the diabetes, although if somebody has managed to lose some weight, the requirement of diabetic medicines or insulin will come down.
There's a lot of information and also misinformation on the internet, and people are selling different type of fat diets saying it can detox your liver. Is there such a thing? A packet from internet, buy it from internet and use it, and then it can detox your liver?
No, I would call it misinformation, because there's no sort of a packaged food or packaged thing which can reverse the fatty food. It's type of food we eat, and if we can make it a healthy food, low calories, restrict calories, lose weight, that is the only way to reverse fatty liver. There's nothing else which can wash the fat from the liver.
How big the role of exercise is in this process? If the person start taking healthy food, but they still have sedentary lifestyle and then they don't like to move around much, what would you say?
Huge role of exercise, because with food you can restrict calories, but until one does both aerobic as well as strength training, that will be the main sort of role of lifestyle change to reverse the fatty liver. So in addition to reducing calories, one has to do the exercise.
If unfortunately the patient is going through the phase of scarring of the liver or cirrhosis of the liver, what is the treatment option? What are their options?
Cirrhosis or scarring has occurred, that is irreversible. It will not be reversed. There have been a few medicines being tried to see if the scarring can be reversed, but these medicines are still under the process of clinical trials. So at the moment there's no medicine which can reverse the cirrhosis or scarring, but fat can be reduced in the liver.
Right. So if the patient has a cirrhosis of the liver, is the only treatment option is the transplant?
Yeah, if the cirrhosis liver has reached that stage of cirrhosis, then the only treatment is the liver transplant. But one can live with cirrhosis for quite a few years, because transplant is offered when the liver cirrhosis is decompensated, means it has reached its complications like fluid in the tummy or jaundiced. So these are the complications which require liver to be transplanted. But early stages, people are given supportive treatment and let the own liver go as long as it can go. But when it has reached its final stage, then liver transplant is the only treatment.
Only treatment, okay. I want to push a little bit more on this question, is like, I believe if we take the affected liver out, we cut it out, the liver can grow itself. That's the only organ in the body that can grow itself. So when the scarring happens in a certain areas where we can take it off, or the scarring is everywhere. So even we can't take any part off and leave the healthy in.
Scarring is uniform in the liver. So if somebody has even some portion of the liver without scarring, that person will continue to live like a normal life.
Okay.
So even if 1/3 of the liver is there, people can live. But when cirrhosis has developed, it affects the liver completely. It doesn't affect liver in certain portions.
So if the scarring is uniform everywhere. Okay, let's sum up our conversation. And what are your recommendations to the general public? What can they do to stop from becoming the victim of fatty liver disease? And for the patients who are already going through fatty liver disease, how can they improve their quality of life and reverse it?
The main message is, after listening to this podcast, go and have your weight checked.
Okay.
Compare it with your height. And calculate BMI. How to calculate BMI is there on the internet, so they can calculate their BMI. If your BMI is more than 25, just try to eat healthy, embark on the exercise. In the beginning, you may need to just do a small amount of exercise and gradually build it up. I think that is the main message of the podcast, because there's not going to be any treatment for fatty liver. You have to prevent going into fatty liver, maintain healthy weight, eat healthy, and keep an eye on your blood pressure and weight. And particularly if somebody has a family history of diabetes, or people they have obesity or being overweight in the family, they need to particularly look for whether they are developing fatty liver, and initiate these changes early in the life, because until fatty liver has gone to a late stage, many people will not have any symptoms. So look at your own parameters for weight, height, have your blood pressure and sugar checked, and if there is anything wrong, then try to make changes in the life and diet.
Thank you very much. There's one more question, because more and more children, they're becoming obese. They are taking wrong type of food because there's food abundance, which is processed food. And as a result of that, I think is upcoming is diabetic pandemic. And some of the parents, they are not really serious about their children's health, and they believe we can feed anything to the children, thinking they are like a kind of machine. We can feed anything to them and they'll be fine. So what is your message to the parents? Because children are taking wrong type of food now. Can they develop fatty liver disease in the future?
The strong message is that fatty liver doesn't spare any age. And if a child is obese, overweight, they will develop fatty liver and at an early age, and they may get cirrhosis even before the age of 40 or 50. I've recently seen a son of a colleague who is doing GCSE and has got abnormal liver functions and has developed diabetes. And if you look at weight, his BMI is very high. So I think children, nobody is spared. Children are spared, and fatty liver is diagnosed more and more in children who are obese. So parents need to make sure that they are eating healthy and doing some exercise.
Thank you very much, Dr. Ali, for today's session. The information has been very useful, and I believe our viewers has found it useful. Thank you very much for joining us.
Thank you for inviting me.
Many thanks for watching this episode. If you found this useful, you can share with your family and friends. If you haven't already, make sure to subscribe to this channel. If you have any health related issues and need help, you can write the questions in the comment section and we'll try to help you as much as we can. Thanks for watching.